Did you know that nearly 60% of adults worldwide suffer from at least one chronic illness? Heart disease, diabetes, cancer. These aren't just conditions, they're life-altering realities. But what exactly is chronic illness, and how can we take control of our lives to prevent or manage it? Today, we're diving into the facts, the challenges, and the solutions to living a healthier, more empowered life. Chronic illness has become one of the biggest health challenges of our time, affecting millions across the globe. But understanding what it is and how it impacts our lives is the first step toward overcoming it. Chronic illness is more than just a medical term. It represents a category of diseases that persist over a long duration, often lasting months or even years. Unlike acute conditions, which are typically short-lived and resolved with treatment, chronic illnesses demand ongoing medical attention and lifestyle adjustments. These conditions often develop slowly, but can lead to severe complications if not managed properly. Globally, chronic illnesses are a growing concern. According to the World Health Organization, they are responsible for 71% of all deaths each year. Diseases like heart disease, diabetes, chronic respiratory disorders, and cancer top the list, often linked to lifestyle factors, environmental conditions, or genetic predispositions. Chronic illnesses don't just affect the individual, they have ripple effects on families, healthcare systems, and economies. The physical, emotional, and financial burdens can be overwhelming, but with the right strategies, these challenges can be mitigated. To truly address chronic illness, it's crucial to understand which conditions are most prevalent and why they're so widespread. Let's take a closer look at the most common chronic illnesses and their impact. Chronic illnesses encompass a wide range of conditions, but some are more prevalent due to their widespread risk factors and global presence. Here are the most common ones. Cardiovascular diseases, CVDs. Cardiovascular diseases, including heart attacks, strokes, and hypertension, are among the leading causes of death worldwide. They are often linked to risk factors such as poor diet, lack of exercise, smoking, and stress. Over time, these habits contribute to arterial damage and increase the risk of life-threatening events. Diabetes, both type 1 and type 2. Diabetes are chronic conditions that affect the body's ability to regulate blood sugar. Type 1 is an autoimmune disorder, while type 2 is largely preventable and tied to lifestyle factors such as obesity and inactivity. Uncontrolled diabetes can lead to complications like kidney damage, neuropathy, and even blindness. Chronic respiratory diseases. Conditions like chronic obstructive pulmonary disease, COPD, and asthma significantly impact quality of life. These are often exacerbated by environmental pollutants, smoking, or genetic predispositions. Over time, they lead to progressive lung damage, making even basic activities a struggle. Cancer. While not all cancers are classified as chronic illnesses, many types, such as breast, colorectal, and prostate cancer, require long-term management and care. Early detection and prevention play a crucial role in reducing mortality rates. Autoimmune diseases. Diseases like lupus, rheumatoid arthritis, and multiple sclerosis occur when the immune system mistakenly attacks the body's own tissues. These conditions can be debilitating and often require lifelong treatment to manage symptoms and prevent flares. Mental health disorders. Chronic mental health conditions, such as depression and anxiety, are often overlooked but play a significant role in overall well-being. They can exacerbate physical health issues and reduce the effectiveness of chronic illness management. Understanding these common illnesses gives us a clear picture of what we're up against. But what exactly causes these conditions to develop? And how can we take control of the factors within our reach? Let's explore the underlying causes of chronic illnesses. Chronic illnesses do not develop overnight. Rather, they are the result of a gradual process influenced by a combination of genetic, environmental, and lifestyle factors. Understanding these underlying causes is essential for prevention and effective management. One of the most significant contributors to chronic illness is unhealthy lifestyle choices. Diets rich in processed foods, refined sugars, and unhealthy fats are a major culprit, as they lead to obesity, diabetes, and cardiovascular diseases. When combined with a lack of physical activity, these dietary habits not only slow metabolism, but also increase inflammation throughout the body. Smoking and excessive alcohol consumption further exacerbate the risks, damaging organs and weakening the immune system over time. Environmental factors also play a crucial role in the development of chronic illnesses. In our modern world, exposure to pollutants, chemicals, and toxins has become nearly unavoidable. From the air we breathe to the water we drink, and even the cleaning products we use at home, these environmental stressors can accumulate in the body and lead to respiratory diseases, certain types of cancer, and autoimmune disorders. Chronic stress is another silent yet pervasive contributor. When the body is under constant stress, it releases elevated levels of stress hormones like cortisol. Over time, this can lead to systemic inflammation, high blood pressure, and a weakened immune response. The impact of stress often manifests in conditions such as heart disease, anxiety disorders, and depression. Genetics also play a role in the development of chronic illnesses. While we cannot alter our genetic makeup, understanding our family history can empower us to make proactive lifestyle adjustments. Those with a genetic predisposition to certain illnesses, such as diabetes or hypertension, can benefit from early interventions and regular screenings. Social and economic factors further compound the issue. Limited access to nutritious food, quality healthcare, and safe living environments disproportionately affects lower-income populations, putting them at a higher risk of developing chronic conditions. Financial stress and lack of resources can also prevent individuals from seeking preventive care or managing existing health concerns effectively. Finally, the natural aging process increases susceptibility to chronic illness. As we age, the body's ability to repair itself diminishes, making conditions like arthritis, dementia, and cardiovascular disease more common. However, adopting healthy habits can significantly delay or even prevent the onset of many age-related conditions, proving that age is not an unchangeable determinant of health. Now that we understand the factors contributing to chronic illnesses, the question becomes, how can we take control and prevent these conditions from dictating our lives? In the next section, we'll explore practical strategies to protect our health and build resilience against chronic diseases. When it comes to chronic illnesses, prevention truly is better than cure. While some conditions are influenced by genetics, many are directly linked to lifestyle and environmental factors, meaning there's a lot we can control to reduce our risk. Start with healthy eating habits. A balanced diet packed with whole foods, fruits, vegetables, lean proteins, whole grains, and healthy fats provides the nutrients your body needs to function optimally. Avoiding excessive sugar, processed foods, and unhealthy fats is equally important. Make a physical activity a priority. Regular exercise not only improves cardiovascular health, but also enhances your immune system, lowers blood sugar levels, and helps you maintain a healthy weight. Aim for at least 150 minutes of moderate aerobic activity each week, such as brisk walking, cycling, or swimming. Stress management is another key factor. Chronic stress increases inflammation in the body and can exacerbate conditions like hypertension and diabetes. Techniques like meditation, yoga, or journaling can be incredibly effective in lowering stress levels and improving mental health. Don't underestimate the power of the quality sleep. Your body repairs itself while you rest, and poor sleep is linked to an increased risk of conditions like obesity, heart disease, and depression. Adults should aim for 7 to 9 hours of uninterrupted sleep each night. Finally, make regular health checkups a habit. These appointments help catch potential health issues early when they are easier to manage or treat. Preventative care, like vaccines and screenings, is also an essential part of staying ahead of chronic illnesses. Prevention is a powerful tool, but sometimes chronic conditions are unavoidable. When that happens, how can we adapt and live our best lives despite these challenges? Living with a chronic illness can feel overwhelming at first, but it's important to remember that you are not alone and that effective management is possible. The first step in coping is education. Learning about your condition helps you understand its triggers, symptoms, and progression. Knowledge empowers you to make informed decisions about your care. Building a strong support network is also critical. Whether it's family, friends, or support groups, having people you can lean on provides emotional strength and practical help during difficult times. Collaboration with your healthcare provider to create a personalized care plan is equally essential. This plan should include medication management, dietary adjustments, exercise routines, and mental health strategies. Don't underestimate the importance of stress relief techniques. Practices like mindfulness meditation, therapy, or spending time in nature can reduce emotional burdens and improve overall well-being. Engaging in gentle physical activity, swing such as yoga, tai chi, or even light walks can alleviate symptoms and boost your mood. These activities improve circulation, flexibility, and energy levels, which are often compromised in chronic illness. Finally, celebrate small victories. Managing a chronic illness is a journey, and acknowledging progress, no matter how minor, can keep you motivated and positive. While these strategies are vital, the field of functional medicine is paving the way for a deeper understanding of chronic illnesses and how to treat them. Functional medicine represents a shift in how we think about healthcare. Instead of merely addressing symptoms, it focuses on identifying and treating the underlying causes of disease. This approach considers the interconnectedness of your body systems and the ways your environment, lifestyle, and genetics interact to influence your health. For example, functional medicine practitioners might explore how gut health impacts autoimmune diseases, or how chronic inflammation contributes to cardiovascular issues. By addressing these root causes, they create personalized care plans that aim to restore balance and long-term wellness. At Pure Living, we're passionate about spreading awareness of functional medicine's potential. Through our resources, coaching, and community, we aim to empower you to take charge of your health journey with evidence-based holistic strategies. So, what's the takeaway? Let's bring it all together. Chronic illnesses may be a significant challenge for modern society, but they are not insurmountable. By understanding their causes, adopting preventative measures, and embracing holistic approaches like functional medicine, we can take meaningful steps toward healthier, more vibrant lives. I invite you to reach out to us at Pure Living. Together, we can explore the best path forward for your unique needs and circumstances. If you found value in this video, don't forget to like, subscribe, and hit the bell icon to stay updated on our latest content. And if you're ready to take control of your health, visit our website to learn more about how we can support you in finding the best functional medicine coach.